So, welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have a great guest today who I've been after for about a year, which is just a busy woman. And I'm so happy to finally get her to have this conversation with me today. This is Dr. Margarete Ribeiro-Dasilva. She is a clinical professor at the University of Florida College of Dentistry, where she serves as a director of the Dental Clinic Research Unit and Clinical Prosthodontics Director. She received her DDS in 2001, Master's 2003, and PhD 2005 in Prosthodontics, Clinical Research from the University of Campinas in Brazil. She subsequently completed a postdoctoral fellowship in pain research at the University of Florida, and in 2009 she was awarded a KL2 grant through a UF Clinical and Transitional Science Institute, and later earned a second master's degree in Clinical and Transitional Science. She is an NHI-funded and actively leads research on transitional approach to chronic pain with a focus on photomodulation, and its role is modulating inflammation and pain. She has held multiple leadership roles at UFCD, contributing the research infrastructure, clinical education, and faculty governance. In 2016, while she was pregnant with her daughter, she was diagnosed with breast cancer. She underwent chemotherapy during her pregnancy and continued treatment following delivery. Her experience has further strengthened her commitment to advanced health research and supporting patient-centered areas. So, Dr. De Silva, thank you so much for being with me today.
You're welcome.
So, could you share a little bit about yourself and your background in prosthodontics? Some of the audience may don't know what prosthodontics is to begin with. So, if you can just give them a little bit of a background.
Okay, so in dentistry, prosthodontics basically is the profession and the specialty that restore teeth, basically with implants, crowns. Also, like a little bit different because, like you read, my background is from Brazil. Over there is the area that's responsible to work with occlusion. That's how your teeth touch, and also the temporomandibular joint disorder. That's a chronic pain condition. So this is how I got involved in pain.
Okay, perfect. How did you first find out about breast cancer diagnosis during your pregnancy?
So that was a unique situation. I was pregnant of my daughter. And to be honest, although it's well advised to do the breast palpation, right, for cancer screening, I never had done. But I was pregnant and I was treating my breast for breastfeeding, putting cream on it, when I found a lump. Being in the medical field, of course, dental field, I knew that if something is hard, not painful, and not moving, right? There is a great chance to be cancer. However, I thought it was some of my breast milk ducts that was calcified or something. I was concerned, but I got through palpation and then I checked with my OBGYN and then everything started.
Got you. Um, and then so from that point, how was your emotions and what kind of emotions and thoughts ran through your mind when you received diagnosis, what you were expecting?
Yeah, of course, as I think everybody that go through cancer diagnose, the first thing I'm gonna die, right? So I always say that I was in panic for 15 days, where I was crying every single day, wake up in the middle of the night and completely panic because basically I had a 6 years old and I was expecting a baby. And I was like, of course, questioning why now, right? I'm going to die and leave two kids behind.
Mhm, mhm.
And the emotions are very, very hard. And what I say to everyone that go through this experience always, try to be in the bright side. Don't be in the dark side because not all diagnosis is a death sentence. But you only learn that when you go through, right?
Mhm,
So.
mhm.
Um,
Yeah, that's a very important part. Like you were really make a point, right? Everybody say that, but you go through that and they stay on those shoes. But hopefully we'll try to remember that. So locally, I have not been on your shoes, but treating every day tons of patients that are going through that. And that has been able to tell me, and everything I have been learning through you guys, to the podcasts, like guest interviews and all the, study I've been doing, is that, right? Try to be able to be in a position where I can advise a patient. You can feel really a lot of darkness right now, but I want you to see ABC in a positive way, because if you go with a really no good mind and negative mind, then things are not gonna go right. So the
Exactly.
mind is so powerful. So the more positive you going into this, the better you're gonna be coming out of it. So
Yeah, I had a close friend he's not breast cancer doctor, but that treats cancers, but other type of cancers, but a very close friend of mine, and I remember very vividly he's saying, I know who will survive cancer and who is not. And this started with how you face the condition.
mhm.
So if you face positively, the chances of getting out of it is pretty high. But if you start negative and cannot come out of these negativities, the chance of survival decreases significantly. So I said, okay, I know how to do it.
Yeah, that's a very good point. Um, what help you to navigate both the joy of pregnancy and the fear of the cancer at the same time? Because now it's different to have the news when you have to worry about yourself, but now you have to be worried about the baby, right? On top of everything.
Yes. I hope who is listening to this podcast doesn't go through this because it's not fun. I think what happened to me a lot, of course, each one has your beliefs, but for me, it was my faith. I really trust, and although it was very sad, I think my turnout moment was when, because I was really afraid of lose her,
Mhm,
or me leaving her behind. And my turn point was that one day I was praying very hard about it and trying. And that day I stopped question because I was questioning too much. Why me? Why me? And my treatment was very fast, thanks to God. So when I got to the chemo and I saw how many people were there, I said, I think I okay. So
right.
on that night, I basically got into put in God's hands, and I said, if I question, if I don't want to go, and it's my time to go, you will take me, no matter what I do.
Mhm,
So I only ask you to take care of my kids.
mhm,
It's really hard to me to say that, but I will give in your hands. You know what's the best for them and for me. So from now on, I will not cry anymore. I will keep going, believing that whatever is for me will be there. But if it's only feel my time here is short than I wish, I
mhm,
would leave them fully. So that day I stopped crying, and everybody was asking, "How can you stop crying?" I said, "There's nothing that I can do. The only thing that I can do is fight against, and I
mhm,
will keep fighting."
mhm.
So if it's not meant to be, there's nothing that I can do.
That's true. That's true.
So then I kept fighting.
How far along were you pregnant when that happened?
I was 5 months.
Okay. Okay.
The sad part really took my focus out of my pregnancy, because, well, kind of, because to be able to get the chemo, I had to do very difficult decisions between me and her.
Mhm,
And those, I think, was the hardest ones that I had to pray a lot because I'm dentist. One of the decisions was, oh, you wanted to put the port or do you want to put the veins? If blow out your veins, you may lose muscle and other things, and you're a dentist. So then I said, if I don't do the port and I do the veins, I may lose the way that I can support my family.
mhm,
So what do I do? Like those decisions, I think was the worst.
mhm.
Knowing that I would go through anesthesia, if she would support or not. Afterwards, I could not take medication for pain. I had to support the pain without medication.
Wow.
So it was really, really tough decisions, but I think all the decisions that I made was the best decision that time.
Got you. And I don't know, this is, we took it back 2016, right? So this is
Yeah.
almost 9 years ago. And I didn't know until not long ago. I want to say maybe in the last, maybe pre-COVID, so maybe 5 years, when I have like no idea that was an option in regarding doing chemotherapy during pregnancy. And that was
Hmm.
completely safe for the baby. During one of our tumor boards, we actually brought an obstetrician talking to us about that because we were
Hmm.
like, what are you talking about? No, like you
Hmm.
cannot do that. The baby
Yeah, I
is not
was in
gonna take
reality
it.
from my Dr. Duff that treated me. That was a great doctor, and he told me I was the first one.
Yeah, I can believe it because like I don't think I ever heard of it until like 5 years ago. So
Yeah, here at UF, not
yeah,
first one to be treated
yeah,
because
yeah,
I
yeah.
worked in
Here,
history, but here
yeah,
and at UF, I was the first one.
yeah. So you were like a guinea pig in a way.
Yes. Yes, they based it on what was out there and let's try to the best.
Yeah.
And
Was your chemo medication protocol modified to be less dose, or they just did full dose like
the
any
whole full red, she got the red with me. That's
the red
the one
double?
that's really bad.
Yeah.
Yeah, she got the red one, but she was born completely fine.
Okay.
She
Yeah.
had like a little bit of, and we not even know, right? Because a lot of kids is born with some heart like conditions, but it was light. She recovered with a 1 year old, nothing major, and she was borderline deaf in one of the years. That it was one of the concerns with the chemo that can cause deafness. But she recovered all.
Oh
By two
wow.
years old, she was normal hearing.
Oh wow. That's excellent. That
Hmm.
was gonna be one of the things I was kind of wondering, right? Like how much cardiotoxicity that was gonna give a baby, right? Because we're talking about like the red double is one of the cardiotoxic drugs.
Yes.
So how much did they give anything for the baby, heart protection or anything at all?
No, nothing. Nothing, nothing. They treated like she was not there.
They are still waiting for as long you're off the first trimester, I believe, right? They don't do anything during the.
Yes, yes. I was right 5 months, 25 weeks.
Okay. And then they treat you all the way through until the end of the pregnancy or
Yes.
okay.
Yes. The other thing that was crucial too, that was a catch, but this is what I'm saying. I believe in divine intervention because the most problematic thing is that I would have to take the medication every 2 weeks, not every 3 weeks, because to be able to have a week or two before having the C-section and not let the pregnancy go too further to 40 weeks, because if she was born in the time that my immune system was down,
Mhm,
I was in jeopardy.
mhm.
So that was all planned, and then say, take this chemo without the I forgot the name of the injection that they give to stimulate your immune system to go up.
Yeah. Yeah.
That one is very toxic for pregnancy, so
Oh,
they didn't want to take the risk.
okay.
So
No,
they were
okay.
concerned that my counting will not be enough to be
Okay.
do every 2 weeks, but they didn't have too much choice. So the plan was, let's do every 2 weeks, see where we stand. Then we can postpone and put like go back to 3 weeks and see, and we monitor, and then we will see what happened. But if she's born in the middle, there will be a high risk. And that I did every 2 weeks, my blood cells counting never went to the lowest possible, but never trespassed the lower of a normal
Yeah.
lower. You know what I mean? So the baseline of the lower that normally is, but never went down as they expected. So gladly,
Very good.
um, I made it. I made the 4 every 2 weeks, not every three, without the shots, and be able to have her 2 weeks
Wow.
resting to go up a little bit more the cell counting and not having problem.
Okay. Did you do anything with your nutrition? Did you change anything on your nutrition to keep your immune system up during that time?
What I did basically, and I was doing very truly like, it's like no matter if I was nauseated, whatever I was feeling, I was determined to eat.
Okay.
So because I didn't want to get a chance of not having nutrition for her, So I pushed myself to the hardest and I was eating healthy, but I was eating. I never, this is what everybody make fun of me because I was the only pregnant that during like chemo,
That was eating all the time.
I was eating all the time and I gained weight. I gained lots of weight.
It doesn't matter at that point. Yeah.
But I kind of felt like I was really in a fight. I was like, I will fight until the end. I will not give up. I will keep it going. And I think this work it.
Um, did your dental or prosthodontist knowledge influence you understood or navigate treatment side effects?
In reality, I think my dental background, for sure. I think more my pain researcher background
Okay.
because I do a lot of pain, so I do a lot of prescription, I do a lot of so I investigate a lot of things. For example, one of my worst fears was develop neuropathy. Being
Okay.
a dentist in my fingers, I need the tactile to be able to do what I do. So then I complement, I don't know if it worked or not, but I was like looking for research, which type of vitamin I should take it,
Mhm.
what I should do to avoid neuropathies. So I was implementing this in my this after Sophia was born in the second one, the second round. So I was taking a lot of vitamins to help with neuropathy. If was that or not, I don't know. I had some neuropathy, but very, very light
Okay.
and went away and never had any problem afterwards.
Do you remember what type of supplements or vitamins were you taking?
Vitamin E,
Okay.
vitamin C, vitamin D,
Mhm.
and magnesium.
Okay. Perfect. Perfect. What role did becoming a mother play in your strength and resilience during treatment?
The resilience. It's hard. Like, can you rephrase what you asked? Because I was thinking something and then I lost it.
So, what role did becoming a mother playing in your strength? So, you were already a mom, so this is your second baby. So,
Hmm.
how do you think that, you have resilience when you fighting against a disease and you don't have to be in this earth for responsibility, right? So it's like, well, you can give up more versus,
Hmm.
you have a 6-year old and you have another baby in the way. How do you feel like, being a mom just was going to increase this resilience to fight
Def
this threat?
Definitely. It's like I said before, it's like you have to fight. You have two people that depend on you. Although like it was not in my control, but I think maybe if I was not mom, if I didn't have two people that depend on me, it would be easier to go in the dark side,
Mhm.
right?
Yep, yep, yep,
But
absolutely.
as a mom, I cannot afford that
Uh-huh.
because I have two people that was depend on me and I kept fighting. So definitely I think it was a strength for me being a mom and like everybody says, right? When we are moms, we are lions.
Yep,
We
yep,
fight for
that's
our
totally,
cubby, right?
totally.
So definitely helped me a lot.
How did you do with like, breastfeeding? Were you able to
No, 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 no.
because
No, because the chemo, I continued chemo afterwards, and this was also a plan, right? So ideal they would, and to be honest with you, it hurts me a little bit when I think, but I said everything have a meaning. But for example, I was supposed, like the treatment normally, they do the mastectomy because then they can do better biopsy, right? But I could not do it because I was pregnant. So they treat me as ductal carcinoma. In reality, I had acinar carcinoma that was not, it was a different um, cancer that the chemo that I received was not for that cancer.
Oh, wow.
So all that I went through, inclusive the anaphylactic shock that I had with the white part of the chemo and everything, lost hair, everything that I went through, everything that Sophia was exposed to
That
was
didn't
not
directly
needed.
happen. Oh, wow. Wow.
So for me, hurts thinking about it, but I could not do the mastectomy. They didn't do anything wrong. They could not, Sophia would not resist the mastectomy.
No,
It's
no,
too
no,
much
no. Yeah.
anesthesia.
Yeah.
So they had to treat the way that they did. So then while I was doing the chemo, so they decide not do the mastectomy, do the chemo first, mastectomy after. So then I was with the chemo, she could not breastfeed.
I got you. I got you. So how long were you in chemo after she was born?
Yeah, wow, she was born 1 week later, I was in chemo again
And then for how long before the
for
mastectomy?
4 months.
Oh, wow. What is the different regimen between for because it's a very rare type of cancer where you had then?
Yes. So there is no, it's no only mastectomy.
Oh, so
It's
not
not,
even chemo.
no, because there's no chemo for it.
It is. Did they do an oncotype with you at that point?
What they did in reality was like this. But so then I did, so I had the 4 chemos with Sophia, the red one.
Oh,
Then I had a 2 weeks period to rest. And then when she was born the same week, I started over it. So then I did all the white chemo was 16, so every week until November was uh, Thanksgiving week for my luck or bad luck
mhm.
because I finished and I was so thankful that I had finished, but it was a long weekend.
Okay.
2 days later, for the first time, the tumor popped out of my breast
Oh,
and I could
wow.
see the tumor. Until that point, I never saw the tumor.
Wow.
And then I was in panic because I said, what's going on, right? So, but I could not call anybody because it was a long
Oh, the
weekend.
holiday. Oh my God. Yeah.
So then on a Monday, I called my surgeon, and because I was scheduled to go to surgery in December 22nd. And she said, no, come here, let me see what's going on. And then she did the images and everything. She said, little things get me scared, but this one is scaring me because it's 3 times the size that when you start chemo.
Oh,
So
wow.
then they had to do it. But if it was not that, like when it was little, that very little, they would do mastectomy, radiation, and then because there is no treatment for actinic breast cancer.
Wow. Wow. I have no idea you went through all that. I think I kind of made you after the fact, right? So after the
Yeah.
whole mastectomy. Wow.
Yeah. It
So,
was then I had to do the radiation when
uh-huh.
the diagnosis came. So then I did 32 radiation, and then there was a new drug in a clinical trial for those type of cancer. And I took, but then it was oral for 4 more months.
Do you know the results of the trial after the fact? That was a trial.
Not e-
No, no
no.
idea if that was actually a good outcome out of it. Um, has your cancer journey influenced the way you practice as a prosthodontist and pain management?
I think more pain management. I'm more, how I say, I think going through all the, because I went through a lot of pain through the treatment, and I think made me more like passionate, more willing to help, more trying to figure it out how to treat because I don't know, this is my experience, but as pain researcher, I always take care of patients with pain, but I never was in their shoes until that time. And I noticed how much I understand, like all the physicians they are there to save your life,
Hmm.
right? Pain, deal with it, right? But
Yep.
I think this is a little bit of lack of quality time that we could improve in cancer treatment. Maybe now is different, but we're talking about 9 years ago.
Yep.
But that brought me very much the feeling of we have to give quality of life no matter what's happening because pain is debilitating.
Yep.
So then changed my way because I was walking their shoes.
Wow. Wow. Um, how has your perspective on patient care, empathy, and you perhaps already answered part of this, and resilience shifted since you diagnosed and recovery?
How can you repeat?
Yeah, how has your perspective on patient care,
Impatient.
empathy, and or resilience shifted since your diagnosis and recovery?
Oh yeah, like I said before, definitely changed.
Yeah.
And I think and all the drop down since I got cured, and all the effects, side effects that you have afterwards, and everything that I went through, and I'm still going. That although there is no research about it, but I'm pretty sure that several things is consequence of it, like by researching and understand some mechanism. Definitely changed my perspective, and I think a lot have to be done to help those people because the statistics is not there. I think a lot of things is missed after the fact, after all the surgeries, after all the things, all the pain, all the ligaments, all the things that get changed. And then you start like 5 years, 6 years having some stuff that's not conventional.
Mhm.
And you say, I think there is a lot of to be studied and improved in the quality of life of post-cancer.
Yeah, and you're right. And unfortunately, a lot of more things are shifting over cancer survivorship, right? So
Mhm.
it is more and more not just about, okay, this is the chemo and this is the radiation regimens, but I'm sure that since you have radiation, we are really has been dropping a lot of their protocols. So it's not like, 6 weeks of radiation any longer. It's maybe just
Mhm.
3, 4 weeks now for the most part, depending on the cases. But definitely is not as much mastectomies and full axillary dissections any longer. So it's more like let's just really do a sentinel node, and we really need to take more than one node. Let's try to save patients from have lymphedema. Let's don't compromise a whole mastectomy. We don't need to do that. Let's preserve your breast instead. So has been
Yeah.
a lot more like really great outcomes. Let's do an oncotype on somebody to see if you will respond to chemo or not, or
Yeah.
how sensitive are you for recurrence or not. So many things that back then used to be like only people knew, but now it's becoming a standard of care. So that has been a good thing to kind of
But
really.
at the same point, I would say those that went through those more radical, more aggressive type of treatment, I think most like to me is easy to me to make some correlations, and maybe is a wrong correlation because I can be really biased.
Mhm,
But I think a lot of people doesn't have the knowledge to understand, hey, this can be a consequence of what I went through 9 years ago, 5 years ago.
mhm,
How many people had that?
mhm.
What needs to be done to improve that? Like.
You're right. You're right. And sometimes, I was hearing the other day an interview on a podcast talking about that survey, like how a physician doesn't have, unfortunately, a physician doesn't have the time to sit down and say, well, this is what we need to do now. But
Mhm.
perhaps this is some side effects that can be happen 7,
Yeah.
9 years down the road, right? And even if they explain that to the patient at the time of diagnose, you're not going to hear that. You are hearing what, take this out of my body right now, and how soon can we do this? And let
Yes.
me just get over this, that I will worry about what happened 9 years down the road. So,
Yeah.
but you're right. Sometimes it's will be, they were talking about having like a health coach or things on those lines that somebody can sit down with the patient and say, I got it. So do you understand what this means? And spend longer time and answer more questions, have a little bit closer relationship versus the 15, 20 minutes, unfortunately, you get with the
Yeah.
doctors many times to
Yeah.
answer some of these questions and make patients to be more aware of those things to help them to make their decisions, right? So
Yes. Yes.
hopefully things are becoming better on that.
Yeah.
Um, what message do you want to share with women who may be going through cancer during pregnancy?
I would say what I'm answering so far the questions is like be the tiger, take care of your cubs and fight and don't bounce back. Only forward and you will make it.
That's awesome. That's awesome. Um, how old is your daughter now?
9.
Nine. Does she knows what happened?
She knows that it's so cute because of course now she wants to be physician and treat
Oh,
patient with cancer.
oh my God, that's so sweet. That's so sweet.
Yeah, yeah, she can see because I did a mastectomy, but double mastectomy, and I did the flap surgery to reconstruct, but I never put the nipples or anything. So she sees me that, and of course, growing up, she was what was, and now as I would say, it's some scars of a fight that mommy went through. One day when can understand, I will explain. And now it's like and then she's like, "Can I explain now?" I said, "Yes."
Wow, wow, wow. That's really cool. I think
Yeah.
that the more you can get the kids exposed to things, you don't know how many patients I know that they have not tell the kids, or they're like kids don't know anything, or they just hide from the kids to see them?
This was in reality, and I can tell the same. I think the most difficult part was I was I'm more I'm more realistic, right? So I'm too realistic sometimes. My son was 6 years old,
Mhm.
and for him, to me, to lose the hair
Yeah, that was
was the
dramatic.
hardest part.
Yeah,
To me, lose the hair was hard, but it was harder knowing that my son
yeah,
was not taking this well.
yeah,
And um and I was telling him all the time, I said, whether you like, whether you not, mommy will be without hair. It was a process where I had long hair, I cut here, and I said, you see, it's getting shorter, and it will be short. And then to me, that drama was so consuming that I said one day to my husband, you know what? You will shave my hair, and I would tell Joe. Because I cannot live this emotional drama anymore with everything that I'm living with.
yeah,
So then when Walter shaved, I put a cap. So until now, at that time, I didn't have a cap, but I was here. Plus, losing hair hurts a lot. And so me lay down and feel the hair moving in my head, all inflamed and hurting. I said, no, it's enough. So then I put a cap and I get out of the bedroom and Joe was looking for me. I said, what happened? I said, what mommy told you? And then he goes and pull my cap off. I can't believe mommy. I said, I told you that would happen, but it's fine. And then he goes, mommy, you're still beautiful. It's all good.
oh
But
my
listen, you don't go. This was July. And he goes, you don't go out until
God.
December because people will not understand what's happened with you.
Oh my God, that's
But
so
you're still
sweet.
beautiful,
Oh,
okay? It's
oh my,
fine, but stay home.
oh my God. He did not want to shave his head at one point either at
Uh-huh.
that time. Did he never told you that he wanted to shave his head too, like you?
No, no, no.
Yeah,
And he asked me to cover. He
yeah.
said, Mom, it's too much for me. I love you, but cover. I said, it's
Over
fine,
your hair.
cover. I go.
Wow, that's sweet. That's very sweet.
Yeah, but I would say like 3, 4 months down the road, Sophia was born. I have pictures with three of us, and I was without it, and he was completely fine. He's making like funny face.
Yeah.
But I think like each one would deal differently. But I
Yeah,
think
absolutely.
preparing the kid
Yes, super
and
important.
and don't hide because
Yeah.
I think the surprise will be much harder
Mhm.
than something that's homeopathic, like giving little by little
Yeah.
and let them understand that this will go and come back. And I showed the pictures even on the internet. Listen, was this way, then came back. Mommy will go back.
Mhm. Okay.
And
Yeah, that's super important.
mhm.
If you could go back and give yourself one piece of advice at the time of your diagnosis, what that will be?
I said, I think it's don't fear.
Okay.
I think like all the drama and all the suffering that I went through was about fear of one unknown and this mystic word of cancer equal death, right?
Mhm.
So I think if we take this conception, a lot of people would deal better. I said, the chemo for me, like after I went through, I used to joke with everybody, say, wow, you were so happy, you're still so positive. I said, this is better than a hard flu. Flu is much worse than chemo. So it is true for me, was it? And so there was no reason to fear. So I would say, don't fear, keep
Okay,
positive.
perfect. And how do you define survivorship today, both as a mother and as a professional?
Like I mentioned, I still think that many things that I joke that I'm not 51 anymore. I feel like 80s. But I think a lot of it's what the battle. I think there's no way of going that type of battle without any scars, and the scars like catch you up. So I'm not old here. I feel my body definitely, there is consequences of what I went through and that I carry and I keep going. But other than that, I think it's what I also joke, I know, say, listen, it's better be an old lady full of pain and the things that you cannot do anymore
Yeah.
than that.
Yeah.
So I'm super happy.
I got you. What are you doing now to try to improve those issues that you're going through? Are you having somebody who is helping you to navigate through some of those? Is this joint pains happening because are you on hormone blockers or what's happening?
No, no, no. Mine was triple negative, so I don't
Okay.
have any blocker.
Okay.
But my biggest problem, for example, I developed like two torn ligaments on my hips out of the blue, but it was two, it was not one. This is why I think is a lot of the surgery that I have done for doing the flap. Then that one was a chronic pain for a year, nothing solving. And then they decided they would do a surgery. And I said, I don't want a surgery no more. And I keep doing things, exercise. And of course, I do photobiomodulation. I test some stuff and it was solved. Then I went through 2 months of rest and two shoulders frozen. Not one, but two.
Mm-hmm.
Then I went through 6 months of intense pain until we could solve the problem. So to me, like having two hips and two shoulders is not something that a person would, because all the, no, this never happened. So maybe as consequence of. So even being pain researcher, there was sometimes that I was doubting if I could take it because the pain was really excruciating and my profession doesn't help either.
Yeah. Have you
So
have you heard, are you in any hormone replacement?
no, because this is the problem, not being they decide that because of the rare cancer in like the risk benefit, and then I got scared.
I got you.
So
But you know, you're triple negative, so you should,
yes.
it's not
But they said
contaminated.
they don't the time the conversation was that they don't know exactly what feeds this type of sinner breast cancer. If I was not needing,
Hmm.
maybe it was the best choice. But and then I said, you know what? I went through this. I'm fine. But I think like the fact that I was 42 when all this happened, and then I went to menopause right
That's
after.
exactly what I'm thinking. You know, is and again, that has been and something you can maybe look into that, but has been a lot more and more studies about estrogen depletion and frozen shoulder,
Hmm.
for instance, and ligament issues because it's
Yes.
collagen, right? So when estrogen goes down, then all these other things happen as well. So
Hmm.
has been some really good outcomes in like hormone replacement, and then people used
Hmm.
to be when they have this study about, you know, the women's initiative where they scare everybody from hormones was creating cancer, and that wasn't really true.
Hmm.
It has been really a lot more study now, but we can chat
Hmm.
more about it
Yeah.
and then kind of give you some good resources to look into it, to look
Good.
into those options. Because again, at the end of the day, we're looking into quality of life, right?
Yes.
So do I really need to continue just dealing with all these pains and aches and feeling like an 80-year-old when I shouldn't have to if it's things out there,
Yeah.
can perhaps try it and they can monitor and so forth. So
Yes.
excellent. So, Dr. Da Silva, that has been great. Thank you so much for all this. We need to do another podcast about pain.
Yes.
I really would love to do, I kind of wanted to get more your personal history on this one, but I think we need to do a part two when you tell me
Yes.
all your, like, all the results from your, pain management and TMD disorders and so forth.
Hmm.
So for sure, I need to bring you for us part two, and hopefully it's not going to take us a whole year to do that.
It's true. I'm sorry.
No, 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 no. I get it. I get it. It's life gets busy, and then yeah,
Yeah.
it's hard to do. Is anything else you want to tell the audience before we wrap up?
No, I think we cover all. It was a good conversation.
Oh, that was great. Thank you
Yeah.
again for really this great information and sharing your story with us today.
You're welcome.
Okay, you have a great evening.
You too. Thank you.
Okay.
Bye.